We were fairly united in a view that FGC is almost universally appropriate in crisis situations. We thought it could apply in all of the situations involved. One key factor about how it can apply is it will need to be sensitively and differently applied. So if an organisation has too many procedural constraints or difficulties in altering timescales, something like that, then that can make life much more difficult. Number two, everybody felt it could actually help with the crisis, as it can bring family members together, or at least acknowledge the differences and what's going on. Same with professional groups. But we did note that it could need some urgent action if, in Toby's words, it was an acute crisis. You know, something bang there, had to be done, okay, get that out of the way sort of thing, move on. Third point, different timescales and workloads could be needed for relationship breakdown. That sure, you can have situations where you can't immediately get an FGC, but you might take time to get people prepared and engaged for it. Number four, one more to go after that. Lack of capacity shouldn't stop it. It needs dealing with as it needs dealing with in life. That you might need an advocate or you might need somebody to act for you, because that's exactly what might happen there. And lack of capacity can also, particularly in mental health, be something that sort of comes and goes, as it were, that is a temporary situation. And then the final point, really, that lack of willingness to involve could mean that the FGC for that particular individual can't and doesn't occur, but it shouldn't mean an FGC doesn't occur, because in the way that the Care Act suggests, it could be an FGC for the carers, not directly for the client. And just one proviso about that certainly within, say, some mental health services, the idea that you're acting for somebody other than directly the patient can be quite difficult. Think family is a bit of a tricky territory if you're very patient and individual focused. But otherwise, FGCs where people don't want to be involved can work, because actually the carers might need that themselves.